In this video, let's discuss about one of the topic in the forensic medicine, that is virginity and defloration. A word virgin means a female who has not experienced a sexual intercourse. Defloration means loss of virginity. Examining a woman for a signs of virginity is done in many countries like Libya, Tunis, Turkey, etc. Virginity testing is made mandatory in some countries to know women's premarital sexual activity, and it is considered as a much controversy and debate as it is against a woman's human rights even if it is done with her consent. Amnesty International considers virginity testing as a gender based violence constituting a torture or a cruel treatment, but ascertaining the virginity of a woman is required in certain criminal and other civil cases, like in case of nullity of a marriage, divorce, defamation, in case of false allegations of a rape or a sexual allegations on a person to harm their reputation or to obtain money, and in case of rape. Recent signs of defloration or a loss of virginity is a positive sign of sexual intercourse or an attempt of sexual act in case of a rape or a sexual assault. And the principal signs of virginity include an intact hymen and a presence of normal condition of a fourchette and a posterior commissure, a narrow vagina with the rugose walls. These signs together may be regarded as evidence of a virginity. Hymen. What is hymen? Hymen is a thin fold of mucous membrane which is about 1 mm thick, situated at the vaginal orifice, which is partially concealing it. There is an orifice in a hymen, the shape of which varies considerably. It may be annular, crescentic, fimbriate, and septate. Menstrual blood and the vaginal secretions flow out through the hymenal opening. Normally, the hymen will admit only tip of a small finger. Such a hymen will rupture if it is stretched or dilated. Rupture of a hymen may cause a slight bleeding, but a hymen has no blood supply. Has no nerve supply, and a woman with an intact hymen which admits only a little finger can be considered as a virgin. The structure and the consistency of an hymen also varies. It may be thin, fleshy, thick, or elastic. In elastic hymen, the hymenal orifice can be stretched without a tear. Sexual act will not cause a tear in such elastic hymens. And the types of hymens include annular. The types of hymen is important for exam purpose, which include annular, semilunar, infantile, cribriform, vertical, septate, imperfect, and fimbriated. Semilunar is the commonest type. In a in a women who are used to do coitus and those who have a born children, the hymen is destroyed and small, round, fleshy projections or attacks which are known as caranculae hymenalis, and the common site of rupture of a hymen following a sexual intercourse is one or both sides of midline on the posterior aspect. And the causes of a rupture of a hymen other than the sexual intercourse include in case of accidents or in case of masturbation or in surgical operation or a gynecological examinations, an insertion of an foreign bodies, an ulceration, scratching of that region, and sanitary tampons. And extragenital signs to consider or to check whether a female is a virgin include in case of virgin, the breast are firm, elastic, hemispherical with a small undeveloped nipple surrounded by an areola which is pink in fair complexed women and dark brown in case of dark women. The breast may become large and flabby by the frequent handling but are not affected by a single act of coitus. False virgin. False virgin is the one who has experienced sexual intercourse but her hymen is found to be intact. Hymen will be tough, elastic, thick, and fleshy, stretches without rupture. Women with the history of sexual relation, pregnant, even prostitutes, or having this type of hymen are recorded. I hope you have got some clarity about this virginity, what is hymen, types of hymen, and extragenital signs of virginity and a false virgin. Thank you.